Knowledge is Power podcast live with your host, Tony Redford, and my co-hosts, LaDonna Sherwood and Francis Larkins.
Knowledge is Power podcast live starts now.
Welcome to Knowledge is Power podcast live. This is a little different show tonight, and I am glad that we're going to have this type of show tonight. And this is going to be a great show. So if you're listening and watching, please stay with us because it is going to be some things that we're going to learn tonight about a number one killer disease, Alzheimer's. And somebody's family, it's going to be someone in someone's family that's going to have this disease. Mm-hmm. And it's not nice. And we want to know all about it and what we can do to help us to understand Alzheimer's and how we can deal with Alzheimer's. So this is a great show, and I'm glad to have you all that's already on already. But right now, let me give me 1 minute. Let me go over some of the our community affairs that's going on in our city. This is what we're all about. So I want to go over that with you before we bring our guest, Mr. Herman Davis. He's going to tell us all about the risks of Alzheimer's. And before I forget, Herman, I wrote it down. I'm going to ask you, I want to know the difference help me understand the difference between dementia and Alzheimer's. So that's going to be my first question I bring back when we go over these PSA announcements. Let's see. Okay, right here, the All White Affair fundraiser. And please join hosts Kurt and Sherry Vital for an event supporting Kristen Manuel Hayes for State Representative Texas House D22. That's going to be Saturday, August 27th at 6:30 to 9:30 at 2021 Cashmere Drive in Port Arthur, Texas. We're going to be supporting. Kristen for State Representative Texas House D District 22. You can make your donations by check at 1310 Cavern Street. I'm going to also post up later the QC code so you can deposit and make your deposit in and make your donation. Let's go to the Beaumont NAACP and Youth Council, the second annual Lafayette Spivey Jr. Golf tournament. Voters registration and voting in golf tournaments. It's more of a membership drive. That tournament is October the 1st at the Bayou Den right here in Beaumont. $80 for one player, $320 for a team of four. Registration ends at September the 20th. That's at 7. Okay, so they're going to have cash prize and hole in one. So please register for that. And we're going to move on to our guest. Let me make sure I've got our tune up ready. Let's see if we got that going on. All right. Mr. Herman. Go back here and I'm going to move on to this and we're ready. Okay. Okay, we've got a couple of shout out for Lillian Brown. She said hello there, and big shout out to Big Floyd Hope. He's about 4'9".
Hi, Floyd.
He's a cowboy. Fan, and we've got a couple of awards. Just want to say hello, and we want to thank you all for joining us. Let me get our music down a little bit. There we go. So we can hear Mr. Herman talk about Alzheimer's. This year I got another one. Okay, another Facebook.
Happy birthday, Terry.
Happy birthday, Terry Roy. Terry Roy is going to be, how old is Terry Roy going to be? 66, 69? What? No, that's the year. No, wait, that's the year he come out of school, right? Oh, no. Hey, Terry. Happy birthday, man. Enjoy yourself, guy. Let's see here. Herman Davis. Oh, you're going to be 62 years old. Well, you don't have to tell your age. I was just messing with you, man. I just messing with you. You don't have to tell your age. We've got Herman Davis. Herman is at the, we're going to talk about the number one killer disease, Alzheimer's. And Herman, the number one question I want to ask you: what is the difference between dementia and Alzheimer's?
Okay, Tony, can you hear me well?
I can hear you well.
Okay, great. First of all, thank you for giving me an opportunity to share some information about Alzheimer's and what we can do today, including clinical trials that we got going on right now. Dementia is more of an umbrella term when it comes down. It's not specifying any disease. It's more of an umbrella term, what happens to the brain, and it can cover a lot of different types of illnesses. So when people say dementia, they're not really being disease specific. Alzheimer's is a type of dementia. It's more of a it's a terminal disease that really attacks the brain. It begins with what we believe is plaque that builds up over a period of 10 to 40 years. So a lot of times people can be what we call preclinical AD, meaning they can have the plaque already there in their 40s and 50s and never realize it. And then it can manifest itself later on. But Alzheimer's specifically is the name of the disease.
Well, how young can you be to have Alzheimer's?
Well, the body, everybody operates differently. Of course, in general, it happens later on in life. But, I've seen and heard of some cases that people develop Alzheimer's a lot earlier. I've seen some folks in their 40s, some folks in their 50s actually develop. There's no real timetable on it, but generally it happens a little later on in life after the plaque buildup happens for some years.
Now, Terry, who is not with us tonight, he's one of our panel guests. I'm sorry, one of my panel's hosts, and he is saying he had a patient in his late 30s to have Alzheimer's.
Yeah.
Is that possible? I mean, that early in life?
Well, I mean, with the body, anything's possible. Like I said, generally it happens later on, but there are some rare cases that can happen earlier.
So you have a clinical research study for prevention of Alzheimer's disease. Can you tell us about this, how to assess our risks and find out what we need to do? Just give us the steps that we need to take to find out about the plaque on our brains, so that we can, where we are, if we are having plaque in our brains at this age, our age, or should we wait? Or what age should we start to assess to find out that we, like a CAT scan or whatever they do, to find out if you have potential Alzheimer's?
Well, let me start by, I think it's appropriate for us to just talk about clinical research first.
Okay.
Because I think, especially in some communities, clinical research is like a bad thing. And rightfully so, because of the history that it involves. I think we've all heard of the Tuskegee experiment and different things they did with prisoners and vulnerable populations early on. So a lot of atrocities have been done in the name of medical progress against people. So especially in our communities, there's a lot of distrust when it comes down to clinical research. But because of those things in the past, I would go to say that clinical research is more monitored and more heavily evaluated than your regular doctor. Because your regular good doctor, they call them, and forgive me, don't take this out of out of subject, but your regular doctor, that's what they call a medical practice. And some of them doctors, I believe, be practicing on people. So they can they can try different things. They have more flexibility in the medical practice to do those type of things. But in research, we have a specific protocol we have to follow by these pharmaceutical companies, and patient safety is the number one concern. So a lot has changed, and I think we should participate more. When I say we, I'm talking about all ethnicities should participate more in clinical research, simply because every drug or every medical advancement that's taking place has to go through research. Like if you've been prescribed anything in the past and you look on the back of that pill bottle and it say may cause drowsiness upset stomach, constipation, whatever it said, those things were determined through clinical research. Now, the importance of that is that these pharmaceutical companies hold these trials and they gather this data to present to the FDA so they can take this medicine, this drug, or whatever it is, and offer it to everyone. So when they do that, the drug that they offer is only built off of the people that participated. And I really want to drive this point home because a lot of people don't think this way. And prior to me working in clinical research, I read a book called Medical Apartheid, and it scared me. And I see why the distrust is there. But if, let's say in Alzheimer's research, I think right now nationally it's about 2% of African Americans participate in Alzheimer's research. That means that whatever remedies or whatever advances that we have, whether it's Alzheimer's, high blood pressure, whatever else, the advancement's only going to represent the people that participated. So have you ever heard of a situation where someone went to their physician and got a high blood pressure, got medicine for high blood pressure, hypertension, and then they had to go back because that medication didn't work. Then they had to go back because that medication didn't work. It's like you have to try out all these different medications to see what works best on them. Now, true, it may be because their body is specific or just, everybody's different in a way. But it also may be that, and it's shown in some of the blood pressure medications and other medications, that minorities just didn't participate in the research. And therefore, when medicines got approved, they got approved without the data to understand how it affects every ethnic group. So medicine can seem like it's prejudice, but it really isn't. Medicine's only made for people that participate. So before I get into the Alzheimer's talk, I really want to stress that point, because if we want our kids and our nephews and our nieces and our grandkids to have progress in their medical care, that means it's up to us to participate. So I just wanted to establish that up front because that's an elephant in the room. I can talk till I'm blue, but if we don't establish trust and reason on why we should, then I think it won't move the needle some. But back to your Alzheimer's statement. The way Alzheimer's, what we believe, there's nothing out there FDA approved to attack what causes Alzheimer's. Now, if someone's diagnosed with Alzheimer's, what happens is they'll prescribe medications to deal with the symptoms, and it may make them feel better, but it's not going to stop the disease from progressing. And if you know anything about Alzheimer's, you need progress.
Right.
Eventually, you'll lose the ability to really reason and, all the way down to eating. You won't even be able to do your everyday things.
Right.
Yep.
So there's a buildup of this plaque that can take anywhere from 10 years to 40 years before you see any symptoms. And it kind of reminds me of cancer in a way. Because with cancer, someone can be walking around with cancer, early form of cancer, and not even realize it. Yep. When they start feeling the symptoms, start getting the sicknesses, they go and they find out they're like at stage 3 or
stage 4. Yeah, right.
Because now they're just their body's now just telling them, well, that's how Alzheimer's is. So you be walking around with this plaque in your brain and not even realize it.
Right.
So we conducted a clinical trial last year called TRAILBLAZER-2 by Eli Lilly. It was for current Alzheimer's patients, and they tried out a medication that for the first time was really successful at shrinking the plaque. So this is a big breakthrough. FDA labeled it a breakthrough treatment because, like I said, generally we'll focus on symptoms, but we never focused on the plaque. They never had anything successfully shrink the plaque. Now that was good. The only negative thing about that is that if a person loses their memory, we can't give it back. So those people, we can pause the advancement, but it's kind of like we pause them where they are. So they still without their memories, but they're not getting worse.
Right.
The progress is slowing down.
Right.
So kind of knowing that, that's what TRAILBLAZER-3 is. That's the current research study we're doing right now. And it's open to anyone between the ages of 65 and 80 currently right now. And what we do is we have a screening. And anytime you participate in medical research, it's no cost to you. Everything is paid for by the pharmaceutical company. So they screen you first just to see if you're preclinical or not. I mean, they'll run a simple blood test on you, your first visit, to see if you have a protein in your blood, an abundance of that protein called p-tau. We know there's an affiliation with that protein and plaque on your brain. So we send it out to the lab to see if you have that. If you have that and you fit the protocol, then we'll do other things like a cognitive test. We'll pay for an MRI. We'll do all these things just to see if you're preclinical or not. If you're deemed preclinical, if we find out that you are preclinical and you fit the patient description, the inclusion criteria that we want, then there's the treatment phase. The same medication we gave those that had Alzheimer's to shrink their plaque will give you. Now, what we're hoping is that we give you this medication now, today, shrink the plaque today before you have any symptoms, that will delay or even deny the symptoms altogether.
Repeat that again, please.
Okay. Well, we're hoping if you're preclinical, meaning you have the plaque now.
Right.
And if we can determine you have the plaque now, and we give you that medication that we saw that shrunk the plaque, if we can get rid of the plaque now, we can delay or even deny the symptoms from even coming. So you may be high risk. You may have all this plaque build up. We search for the gene to see if you have the gene. We do genetic testing on your blood. We do all that. And if we can get rid of it now, what researchers are looking at, if we can get rid of what's causing it to progress, then maybe we can stop it from even coming. Or even buy you more time. Let's say it took you 10 years to build this plaque. We get rid of it. It may take you 10 more years to get back to where you were. And if you're in your 70s, I mean, and the reality of anyone that's faced with Alzheimer's, time is precious. So whatever time we can preserve and give people more time, it's not exactly the cure, but it's definitely a way that we can prevent it or kick the can down the road for another 10, 15 years or so, which is valuable to anybody.
And what does the testing for the plaque, what is that, like an MRI or?
Well, there are several things we do. And in research, there's a protocol that we follow, meaning that the pharmaceutical company, they tell us exactly what to do in the order in which we do it in. Now, of course, a lot of times in research, what they try to do up front, they try to figure out, okay, what can we do, just being honest, that's least expensive, but that can really kind of knock people out of our inclusion criteria. Because you don't want to start off with a PET scan, which is about $5,000, to look at someone's brain. So they start off with a blood test. And in that blood test, there's a protein called p-tau. And we all produce it, but some of us produce an abundance of it. And that p-tau, we know there's a correlation between the amount of p-tau you have if it's an amount of plaque that's on your brain. And we're still learning that correlation, but we know if you have this much p-tau, then the percentage of the likelihood of you having an abundance of plaque is actually high. So we send it off to a lab, and the lab comes back with those results to see if you even meet that criteria first. If you don't meet that criteria, then you're out of the study because they know that you probably don't have the buildup of plaque they're looking for. But if you meet that criteria, then there's other things we do. We do a cognitive test. It's not a test on intelligence. It's just a test on memory to see your cognitive skills, to see where they are. Then we'll do an MRI. Like I said, all these things are paid for. There's no insurance required or anything else because the sponsor pays for it.
I like that. That's a great study. Hello, Deborah Brown. We're going to say hello to Deborah. She's on with watching this, and Dr. Candace Matthews. She's saying hello to everybody. But back to you, Herman.
I know there's no cure, obviously, but is there something that the younger people can do to help prevent the plaque buildup, or is it just inevitable?
You know what? It's hard to say because you read contradicting research about what causes it. I look at what the majority of people agree with. Majority of people agree with exercise is important. For one thing, that's we don't know if it's diet or anything else. You've seen some studies talk about certain types of foods, but I can't really back that up. What I look for is 10% of the population we know is going to get Alzheimer's. That number is steady no matter what.
It can't be dodged. And this is why I'm so highly interested in knowing more about this, because I've had so many members of my family who have suffered from Alzheimer's. It's a hurtful thing to deal with. The pain, to see them deteriorate cannot remember. Some have long-term memory and some have short-term memory. My mother, like I said, she's in dementia, but she's like progressive right now. It's progressive, and she can tell me what went on in the 50s and the 60s, but she can't tell me what went on right around her the last 5 minutes. And they have a pattern of. She has a pattern of holding on to her purse. Paranoia of you stealing from her. It's a hurtful thing to watch your parents and loved ones to this disease. And if the study that you said, the research study, the clinical research study for the prevention of Alzheimer's disease that can stop the progression of the brain from going into a full run. That's in other words, you're kicking the can down the road, like you said. I can deal with that.
Yeah.
I can deal with that. I mean, but if you in what I understand you saying, if you in Alzheimer in the middle of it and you've halfway lost half your memory, it stops right there where you are. But if you catch it early enough, catch the plaque early enough, you can delay this disease.
Yes, and there's some. I mean, in research, some people actually, when we got rid of the plaque, they're some of their cognitive skills came back.
Mm-hmm.
We did see some improvement on their cognitive skills.
Right.
It doesn't happen in all cases, but we do see it in some cases that people are better. They think clear. They can start, remembering more accurate things and stuff like that. So we see that, but it doesn't happen typically. One thing I do want to mention, the reason why time is, and when I reached out to you, and thank you. I mean, as soon as I sent the message, you said absolutely.
Right.
Time is critical when it comes down to these type of studies. And I'm going to tell you why. The pharmaceutical companies, they want to get this drug out on the market, but they can't get it out unless they have so much evidence that the FDA demands. So when they get the amount of patients they need,
right,
and they're going to close off the screening because they got to submit the data to the FDA, and then it's still a process from that point. We had a diabetes study that we just actually closed screening on. And that diabetes study, it gave free insulin for the whole year. What they were trying to do is, when people take their insulin, there's a daily insulin they take. Well, they were testing out a weekly insulin. So instead of them having to prick themselves every day, there was pretty much like a long-acting insulin. That will help them out the whole week, which is great for people with diabetes. Well, they got free insulin for a year. In a lot of these studies, there's compensation available. So they're paying you for your time also. But once they reach that magic number of we have this many people in the trial, this is what we need. Now you can't come in and new people can't come in and screen. Now the people that are in there, they can still get all the benefits,
right?
So they can get the data. But new people can't come in and screen. So if I tell people all the time, if you see a clinical trial that's with an indication that can help you or your family, participate, even if it's just in the screening. Because once you get your foot in the door, you go through the screening, like the Alzheimer's trial. People say, well, I'm wondering about the medicine. And I don't know if what the medicine will do. I said, first of all, you don't even know if you qualify.
Right.
You don't even know if you're going to be preclinical. But at least if you go and participate in a screening, you'll learn more about yourself. You'll get services that typically will probably cost you hundreds, if not thousands of dollars normally. And then you'll understand what are your risk factors in certain areas. Now, if it comes down to taking a drug, clinical trials, you're in full control. You can participate for as long or as little as you want. So, I'm trying to get as many people that 65 to 80 to come at least get screened, because I don't know when they're going to tell us. I mean, when they did the diabetes one, I came back to the office on Monday and they sent an email saying Wednesday screening is over. So that's 2 days that I had. So folks that were scheduling like 3 weeks out and 4 weeks out, I was trying to reach all those people and try to squish them in those 2 days for them to at least get the benefit, at least get the free insulin, at least get all that. So I mean, I'm really trying to think whatever we can do to pass this on to our people in our communities, because once they close out screening, only those that are already involved will get the benefits. And I don't know how long that approval process is going to take through the FDA for everybody else to get it. And then plus, when they approve it, it's going to
cost money. So right now, like Alan Perkins is asking, how do healthcare and insurance play a role, or if he has missed it? I think you probably stepped in, but I'm understanding Herman to say that you don't need any insurance for this right now. The research company Trailblazer Alzheimer's 3 will pay for it all. And compensate you.
Yeah, what happens is that these, like I said, pharmaceutical companies, they're funding it because their goal is to get their drug approved. So they're funding it. So there's no insurance required, no pay for any of the processes. As a matter of fact, when we do what's called an informed consent, there's even a compensation built into it that people can possibly get compensated for their time. Because keep in mind, they're using this data, even though they're providing services for you. You're anonymous, but they're using your data to get this drug approved. So they pay for your time. I've seen some studies that, I hate to talk money, but I mean, you're talking about a couple of grand that people got paid and benefited from the study. You know, so it just depends on what they require from you during that time, the compensation, you know, and you have to opt into the compensation, but I meet very few people who don't opt in.
Well, and part of the compensation too is so that future people don't have to, there might be a way to stop other people from having to suffer with this.
Absolutely.
Extremely important.
Absolutely. And that's to think about too, because my grandmother passed, and it's the person that's going through Alzheimer's is frustrating for them. But family members, they're caregivers. Caregivers have 35% more health problems than normal people.
Yes. Yes, I agree. I mean, I have a sister that is the caretaker, and let me tell you something. I'm concerned about her now. You know, she is. You know, I mean, she's catching hell. I mean, she's my mother's giving her hell, and she's the caretaker.
Yeah.
And when I walk in and when I visit, I'm the king, and I ain't done nothing, you know. So it's hurtful. I mean, I can tell you maybe 9 to 11 members, a close family member that has suffered from this disease, Alzheimer's. But I want to make everyone know who's watching it or listening, or maybe listening later on, or watching later on during the week, or next week, or whenever you see this podcast, is that you may be able to participate if you are 65 to 80 years old and have normal memory, thinking, mood, and behavior. Have a trusted study partner who knows you well and can answer questions from the study team about you during video calls, and meet additional study needs. I think I have a flyer here that I can place online right quick while Herman talks about it. And if you have any questions, we want everybody to participate if you're 65 and 80 and older. And Herman, if you would, repeat to them again that we're asking and we're encouraging them to participate in this free clinical research study. It's free of charge. No insurance is needed. This is a prevention of Alzheimer's, prevention of Alzheimer's disease. And Mr. Davis has told us that it helps. It's not going to cure it, but it will stop the disease. It's not guaranteed. These are tests. These are research. They want to make sure that you participate in it. I'm going to call the number like right down below at 409-331-6040, or you can email them at gadolin.com. And then also Herman is also saying that compensation may be available for time and travel. So if you qualify for this is a great opportunity. It's a great study. There's no trick bag, there's no con deal here. This is a real deal. This is from the Trailblazer ALZ3. Now, again, Herman, if you would kind of tell them again, repeat just a short segment what you said earlier, so to make sure that everyone know we are encouraging them to do, and the reason why we're encouraging you to do this.
Well, you want to participate in research, especially while the window of opportunity is open. With Alzheimer's, are you talking about so far as how drugs are approved and who they're approved for?
Yes.
Okay. Whenever
a lot of people say, I'm not taking no drugs for this. I'm not doing that. I'm not going. Just like when the COVID. I ain't getting no shot. Well, hell, you ain't got nothing to lose.
Yeah. Well, I mean, and when it comes down to Alzheimer's, people say, well, what's the risk? I mean, you know what the risks are if you don't do anything.
Right.
You know what that is.
Right.
That's a road you don't want to go down. But usually in medical research, any pill, I don't care if it's Tylenol, metformin for diabetes, whatever medicine you've taken has come through clinical research. And all the side effects that you see on the side of the bottle, that's what we determine. We determine two things. We determine what they call safety and efficacy. Safety is how safe the drug is to make sure it's safe for humans to take. And the efficacy is, does it do what it says it does? In other words, there ain't a chance that it's going to work. We've proven with the data that it works. But depending upon who participates, that's what the drug represents. So like I was mentioning earlier, I think nationwide, Alzheimer's research is about 2% African American. So whatever discoveries they're going to make for medications in the future, they're going to make it based on a small percentage of African, as of right now, African American participation. So we've seen in the past where if there was one dominant group represented within the data, whenever your doctor gets the ability to prescribe that medicine, they're not going to say, okay, 98% of one group took it and only 2% of the other group. They're not going to look at that data. They will just see the FDA approved this medicine for this indication. So they'll prescribe it, not knowing exactly how many people participated in it. And that's why sometimes I feel we can have problems when it comes down to prescriptions, because all groups are not represented in that data. So it's important for every group. If you want your child, your grandchildren, your nieces, your nephews, if you want them to have better health care than what we had today, then the only way that can happen is in research. Look, it's like this. Everybody's waiting for the big discovery. When we're going to cure cancer, when we're going to do this. It doesn't just happen. They're not going to just zoom in with the cure. It happens through people participating in research. The more people participate, the quicker they can do the studies, the quicker they'll find the advancements. So if we just wait and hold off, we're just holding off the cure. That's all we're doing.
Trish?
Well, when you're in the study, if you've been approved and you're participating, they closely monitor you, right? To make sure that things are the way they're supposed to be. And
absolutely. Like I said, patient safety is the center of all the studies we do. That's why it's hard to get in a lot of these studies, because you have to fit a strict criteria just to even get in. And of course, the good thing about what we do in research, we can predict almost what can happen, because everything is just done in a strict protocol manner. If there's a possibility of an allergic reaction, we're ready for it, because we already know what the possibility may be. And where we're located in Park Medical 2 in Beaumont. So we're located right next to the hospital. So the good thing about it is, if anything happens, we're right there. Now, I'm not scaring anyone, but when it comes down to allergic reactions, you can go to a new restaurant and eat a piece of cheese that you never had before and have allergic reaction. So you can't predict that. So when I mention allergic reactions, I'm not here to scare anyone. I'm just saying I'd rather be in a place that's secure with medical staff, just in case something happens, than be out in the streets. And
absolutely.
How many times we get prescriptions from my doctor, come home to our house, pop them in our mouth, and we don't even know how we're going to react to that. And we do it from the comfort of our home with no one around. So,
that's true. That's true.
We're here.
And the more people that participate, the more things we know could happen. We're having heads up that they're possible.
Absolutely, and anything that happens, we're equipped and ready for it. If it's by the time it made it to phase 2, phase 3 trials, safety issues are not that big of an issue anymore. because we've already proven that it's pretty safe, that it's not going to destroy you or kill you or really, shut down your systems. We've already proven that. Now we're just looking for the effectiveness, and we're using different groups to say, okay, how does it work with this group? How does it work with this group? They're just trying to find out different things to safely classify the drug on who can take it and who can't take it, maybe. So they're doing that in clinical trials.
Is there anywhere that we can go to find other clinical trials for like my age group who isn't old enough to participate in this one? Are there other ones available, or how would we find that out?
Well, of course, I'm going to do a little self-promoting right here. I'm going to promote our company first because we're doing several clinical trials. I mean, we had trials for ADHD. This is for adolescents. We had trials for, we actually had a real good trial for RSV for babies, for pregnant women to help, because RSV is the number one cause of infant hospitalization in the U.S. We have a trial that can help them out. We have trials for diabetes, like I mentioned. We have trials for fatty liver disease that we can even come in and get a fibro scan at no cost to see exactly what your fat intake is in your liver. Because it doesn't have to be people think of cirrhosis just associated with alcohol. That's not true.
No, it's not. Yep.
Cirrhosis can be associated with a lot of things, but how do you know until you get it? Well, you can come and get a fibro scan and see exactly what the level of it is, how hard your liver is, and stuff like that through us.
Yep.
So you can go to Gadolin, GADOLIN.com, Gadolin.com, or www.gadolin.com. That's our website. And it'll show what trials we are actively conducting right now. We're located right here in Southeast Texas by St. Elizabeth Hospital. Or you also can go to clinicaltrials.gov. Clinicaltrials.gov is a government website that every clinical trial has to register through them. So you can go in there, you can kind of see exactly some information about the clinical trials. You can see exactly some of their inclusion criteria. So you can, let's say you want to look up cirrhosis. You can find any trial related to cirrhosis or COPD. You can see all the trials related to that and where they're located throughout the United States. So you can go to clinicaltrials.gov to see that also.
Man, great information. Great information. I've learned something today, and I love this information that we can share across the social media platforms. We are a podcast that has a platform that is all over the world, and this is something that we all need to know about. In different cities that has the same, how can I say this? A city that wherever you are, there's somewhere that you can get the clinical help, research done, and also participate in it. And again, the age is 65 to 80. But I want to try it myself just to see where I am, because I think about all the time to having so many family members to suffer with it, and I like to know exactly where I stand on it as well. Let's see here. Terry is asking another question here. He says, we're talking about the caretakers. The caretakers really need to take care of themselves. Putting a loved one in it's just crazy. I mean, it's just for a few days, it's good to get away. I had my mother to come here a couple of weekends ago, just spend 3-4 days, just so that the caretaker can have some time,
Yep.
and it's a way to handle them also, when they might ask you the same question over and over again. You just say, hey, okay, well, that's you right, go
They know
along
who
with
you
it.
are.
Yeah, don't don't go against them now, God. It's and I just go along with the program, and so
I do want to mention something, because a lot of people, especially when they get a little older, they're worried because I talk on the phone with a lot of people and they say, well, look, I'm worried now because sometimes I can't remember where I put my keys.
Yeah.
I'm worried.
That's me all the time.
Look, first of all, you feel like I could have qualified for this when I was in my 20s, because I have bad memory, period. But if you can remember that you forgot, you don't have Alzheimer's. Keep that in mind.
Okay.
If you
That's
can remember
important.
that you
No.
forgot.
what about if you were looking for your phone and you on the phone? That's a damn phone.
Don't tell on me.
I did that 10 years ago, so and I'm still okay. You know, it's a person that's like looking for their keys. Say, I know I had these keys somewhere around here. I can't remember where I put them. That's just naturally when we grow older, we're gonna have some memory, and we're made to forget. The brain is actually wired to forget.
Mhm.
It's not wired to remember everything. You'll go
They
crazy
recycle. Yeah.
if you remember everything. You only remember essential things. So it's one thing to forget where you put your keys. It's another thing to forget you even had a car.
Mhm.
You know,
I know I got a car now.
So I'm just saying,
I might not remember where I parked it, but I know I got a car.
There's a difference between the two. See, at least you knew you came in a car.
Right.
Whenever you would, now, an Alzheimer patient will walk in Walmart parking lot and not realize where they are and how they even got there.
Mhm.
They'll walk out in the parking lot and not even remember, where they are and how they got there. So that's the main.
So what I'm saying, being forgetful at our age now is not a real concern.
But I feel better.
I wouldn't worry. I wouldn't stress about it because I'm on the phone with people that are scared. I mean, I call them and they just tell me these stories. I'm like, look, just come in, get screened. And it's probably nothing to worry. And a lot of it is not. It's just It's just a deal of age and just kind of forgetting things naturally. So I mean, of course, I would always encourage people. The brain is a tool. The more you use it, the stronger it is. I mean, crossword puzzles, different types of games, stuff like that. I would always encourage things. The only thing I discourage about social media, I'm pro social media, but sometimes when we're fed things, when we're only in receiving mode instead of thinking in cognitive mode, I think that's, my personal opinion, that doesn't work for us. I think we should always challenge ourselves with different things and stuff like that to keep that muscle tuned up. Now, some people may be watching this that already have someone that's already diagnosed, because this study right here is for people that's not diagnosed. We do have another study coming up for people that are suffering right now from symptoms. So we're about to launch that study in about another week or so. And we even have an imaging study coming up that it's not made for medicine, but we're still trying to learn the correlation between the protein and the plaque. So they can take a blood test and do a PET scan that we pay for, and they actually get paid like $1,200 because they're going to use that data to see the correlation between the the protein in your blood and how much plaque in the brain. Because this is the deal: insurance companies, let's be real, insurance companies don't want to pay for PET scans. I mean, they're expensive. So if insurance companies don't want to pay for PET scans, and PET scans is the only true way we can actually see. There's two ways you can tell somebody has Alzheimer's: through a PET scan, and once they die, through an autopsy, where you can see the plaque on their brain. You can't see it any kind of way. We can see symptoms and maybes, but there's not a hard way of diagnosing without a PET scan. So that's why it's so hard for people to really get diagnosed with it up front. But if they can figure out the correlation between the blood and the PET scan and find exactly what that correlation is, that means that now we can just take blood and figure out how much plaque you have.
All right.
That's medical advancement.
Right. Man,
it's amazing.
Great information. I've learned something here tonight. Hey, listen, you will come back, right?
Yes, sir.
Yeah. I'd like to get you back when this new product comes out. That's those that's already been diagnosed with Alzheimer's.
Okay.
And kind to we will refresh ourselves on this, but also go into the clinical research of the new product, that for those who are already into it. And again, let me say this to everyone that's listening, is that the research, the medical research, the clinical research that you get now will stop it, the plaques, before it goes into a real deep dive into Alzheimer's. But now you're saying you've got a new product that is coming out that for those that are already in Alzheimer's. So what I'm gonna I'm gonna ask you some more about it, but I'm gonna save that for the next time.
Okay.
because I want to. There was a question I want to ask: is that if you're already into it, what would this product do to you? What I mean, would it? I know it's going to stop it, but would it make some? It won't make him go into a progression Alzheimer, will it?
Well, you're talking about those who already have Alzheimer's,
Right.
But aren't
Well,
diagnosed.
yeah. What we're looking at is, like I said, what we believe the plaque is what causes the progression.
Mm-hmm.
So we can get rid of the plaque. We can get rid of the progression. Now, so far as the damage that the plaque done, because you got to think you have these neurons that the plaque is on. So once we get rid of the plaque, it all depends on how much damage is done underneath it,
Right.
whether or not they can kind of go regress
Okay.
or
Right.
something like that. We
Okay.
don't know that yet, and that's still in research. I mean, even with the research we're doing now with preclinical for people that don't have it, they're in observation for years after they're done with their treatment because there's still things we don't know.
Mm-hmm.
We don't know if the plaque is going to come back.
Right.
We don't know how quick it's going to come back. There's still a lot of questions that we need answering, but we can only answer them through time and studies.
Thank you, Herman Davis, everyone who has visited with us this evening. And we've been talking about the risks of Alzheimer's, and he has introduced us to the Trailblazer ALZ3, a clinical research study for the prevention of Alzheimer's disease. Hey, we love it, man. We're gonna pass the word on. We're gonna share it all over to social media so everybody get the messages out there, and call that number so that they can at least find out if they qualify or they're having it. Even the qualifications, if you have it or not. I have the plaques or not, correct?
Yes.
All
yes.
right,
Yes.
good.
You'll come in and get screened, and we'll determine that.
Right. Well, Herman, thank you so much. Thank you, Tricia, for joining. Well, you're here with me all the time. I appreciate the company. I appreciate the company. And Herman, let's do this again in about a month when this new product is coming out for prevention. Yeah, and we'll talk about that again.
Thank you again for having me. Too.
Yeah, no problem.
Thank
We're gonna get the word out, and I just love it. I just love shows like this. I love it. So again, thank you so much, Herman. If anything you'd like to say, you got it.
Well, I mean, just once again, if y'all have any questions, you can call us directly at 409-331-6040. You can ask for me, and you'll speak directly to me, or you can go to our website, Gadolin, GADOLIN.com. On there, you'll see a bunch of information about our studies. I encourage you, though, to call me, and that way I can tell you any new studies that we have in the pipeline. We have people, I call them professional research people. I mean, they call me like every week. Well, what new study you got? And if they qualify, I mean, but I admire those people because those people, they're really in it for the right reasons. They do benefits, but overall, they're helping improve, medicine for all of us.
That's
so thank you for your time again, Tony.
Thank you too. Thank you, Trish. Thank you, everybody. We'll see you on Sunday.
Thank you for watching Knowledge is Power Podcast Live. Be sure to like and subscribe to all Knowledge is Power social media pages.